Hello and welcome to Health 2020. I'm Dr. Sello Mutaung.
And I'm Dr. Doreen Munakisi. It's springtime, compliments of the new season. But be warned, experts have warned against an intense allergy season this year.
So what does it mean then if you suffer from asthma, particularly during this COVID pandemic?
Our expert today is a lung specialist who will help us understand all you need to know about asthma.
Well, but first, let's take a look at how Gillian Mokhale describes her experience of living with asthma during this pandemic.
I found out that I was asthmatic in 2014. I had dropped my daughter off at crèche and I just collapsed in the street, and I was assisted by one of my neighbors, and that called the ambulance, and I was taken to a hospital, and that's when the doctor had diagnosed me, and the doctor told me that you're asthmatic and it seems like you've been asthmatic for a long time. So that's when I was diagnosed. But I do have a recollection when I was younger, when I used to use an asthma pump when I was young. I think I was like 4 years old. Another thing that I picked up is my asthma attacks seem to be stress triggered, because even when I went to the doctor, I remember even when I was at the doctor's room, the doctor had called a therapist in, and the lady was talking to me, and she was asking me like personal questions like, are you stressed? What's stressing you? Is there anything that's bothering you? Stuff like that. And I couldn't understand why was she asking me the questions. Then she also told me that she suspects my asthma attack is stress related. The other attack was when I was in the house with the kids. I honestly don't have much recollection of it. What I remember is I was sweeping, and I had made her a sandwich, and she was sitting on the bed eating her sandwich while I was cleaning out the house. And I had my chest just closed up and I collapsed. My daughter was the one who ran out and had called a neighbor. And then my neighbor had asked my daughter to pass on the key, and they opened the gate and came in the house. And I was able to be assisted. I was given my asthma pump at the hospital, and I was given oral steroids as well. And I was told by the doctor that because it's a mild case, the pump that I use is a normal pump that I can buy over the counter at the pharmacy. Since we're on lockdown and with the corona pandemic, I have been taking extra precautions because I know being asthmatic that I'm at high risk. So I try to stay indoors by all means. I just go out when it's necessarily a must that I must go out. I don't just go out for no reason. And even limiting the amount of people that I have coming to my house. With my immediate family that I live with my husband and the kids, it's not training per se, but they do know that I have the attacks. They do know what to do when I do get an attack. They do know if an attack happens, where will my pump be. It has crossed my mind that it might be because of the smoking, but then I had the recollection that I had problems with breathing before when I was young. And when I was young, I wasn't smoking. So maybe it's just a problem that I had as a child and it reoccurred in my adulthood. My biggest fear is having an attack when I'm all by myself with no one to be able to assist me.
To enlighten us more about asthma is our guest, Dr. Murumisi Mukansi, a specialist pulmonologist and head of ICU at Helen Joseph. Welcome back to Health 2020, Doctor, and thank you for joining us. I think the first question I'll ask is, what exactly is asthma and what are the mechanisms? How does it affect the body?
Good afternoon to you and the viewers at home. Asthma is really inflammation of the air passages, which leads to the narrowing because of the swelling and the mucus that may be produced by the cells that are swollen. And then that leads to a difficulty in breathing, especially exhalation of air. Okay.
So we really are talking about, the air pipes. When you talk about inhalation and the air pipes narrowing, which then brings us to the next question to say, as we had, in our clip, Gillian mentioned that her chest closed up. What are the typical, is that the sort of typical sign and symptoms? Do we have any typical signs and symptoms of asthma?
Typical would be persistent coughing, and maybe tightness of the chest, so with difficulty in breathing, which is really what she had. And then you may find that there is wheezing, especially in younger people. Those are really the things you find.
It's spring season now. We know some of us that have got hay fever problems, etc. Those tend to flare up during this period of time. It's still COVID-19. We're still stuck in the pandemic. And of course, those people that have got asthma also might have flares during this period of time. How does one differentiate between the differences between asthma, allergies, and of course, COVID-19?
I think they are all chest problems, and they all obviously will lead to coughing and other things. But of significance is that if you have COVID, in addition, you will have other symptoms like loss of smell and loss of taste. There may be fever, which may also become present in the other ones. And if you have allergy, it usually will be that you have been exposed to the stimulus that are causing allergy before, and you know that you're allergic. And allergy comes with eyes involved and skin involved as well, in addition to just the chest that may be involved. And there may be family history of that and asthma. While COVID will not have family history, it's really what is the current problem that we have. And maybe the first thinking should be that, is it COVID? And because COVID can precipitate asthma as well.
All right. So I mean, we've described symptoms, for a while now. And we've described the mechanism of exactly how asthma affects the body. But what are the possible consequences of long-standing asthma, especially that's not well controlled? Are there any complications to worry about?
There's quite a number of complications. Obviously, if you're young, you may have stunted growth as you grow because you're not feeding well in terms of your oxygen and the body and the growth. But the other thing that may happen to anyone then is as you fail to exhale air, you have accumulation that may lead to the blowing of your air sacs, and you have what we call pneumothorax. So it's really air outside the lung that then compresses the lung and make it difficult for you to breathe, and may need a pipe on the side of the chest to remove it. Now, if asthma is not well controlled, the logical consequences that you'll get obstructive airways disease, which present in similar fashion to asthma or to emphysema in those that smoke. And in a nutshell, those would be the things that you get.
Quick question. We saw Gillian has got pets. She's a smoker. She mentioned that one of her asthma attacks was exacerbated by cleaning. If I am an asthmatic and I want to have pets, or perhaps maybe I'm a smoker as well, is there any way of preventing an asthma attack? I know we spoke about treatment issues and complications, but when it comes to prevention, how can we go about that?
The cheapest prevention is to avoid pets because they will cause problems. And maybe to protect yourself if you're going to clean the house, especially if you have carpets and there's house dust mite in the carpets and that, because that on its own would be a problem. And then smoking should not be advisable because the symptoms of emphysema and the symptom of COPD and the symptoms of asthma are the same. So you really are damaging your lungs in one way, meanwhile you have a health problem that's affecting your lungs. And so it should be something that's not advisable if people can avoid that.
Wow, that was quite informative. Thank you for that. We're going to take a quick break. When we come back, we answer your questions about asthma and how it affects you. Stay tuned.
Welcome back, and thank you so much for staying with us. So this is what some people said, or, the people that we spoke to asked about asthma. Take a listen.
Is asthma genetic? Can you get it from your parents?
I would like to know what really causes asthma and if asthma can be curable. I'm really curious about that.
Is it safe to exercise when you have asthma?
All right, so very interesting questions there. Let's pick on the first one, Dr. Mukansi. Can you get it from the parents? I guess this talks to, the causes, perhaps genetic causes and risk factors for asthma. If you can just start with that one, please.
Asthma could be genetic, especially if it starts in early childhood, but there could be those that we don't know what causes it, especially if it starts in adulthood. And the predisposing issues there would be pollutants, would be cold air, would be workplaces, and such type of things, and maybe viral infection to the chest or any other infection that you get, which may lead to permanent damage. So you can get those things.
You've already touched on some of the triggers, being smoking, being pets, carpets, dust, and so forth. What exactly are the treatment options that are available? When people talk about action plans, what is the action that one is supposed to take against asthma?
Basically, there is two major categories of treatment options that we have, and we describe them as reliever and maintenance. So in terms of reliever, it's that which you take to relieve symptoms. So if you persistently coughing or you wheezing or you tired, you would really start with that option and see whether it relieves the symptoms for a longer period of time. And then if ever that doesn't happen, or you persistently have symptoms at night, or you require using the relievers much more frequently with a small amount of time in between in terms of relief, and every 3 hours or shorter you realize you're tired, then you may want to add the controller, which is the maintenance medication, and in that you take them daily, whether the symptoms or not, as prescribed or as directed by the therapist that is helping you. And there could be then other options if you obviously don't, get relief from the usual pumps that we have, which is really an inhaled steroid combined perhaps with a long-acting beta agonist or such type, depending on what we think. So we may add on other agents as well to try and relieve you, including some of the newer agents that we call monoclonals that may be expensive, but there is quite a group of things that you can add. Okay.
Yeah, so we heard about, obviously in simple terms, that there's two types of, sprays. There's relievers and there's preventers, as it were. But let's pick on that third question that, one of the ladies there asked about, exercise and asthma. Is it safe to exercise when you have asthma?
It's safe to exercise when you have controlled asthma. That's very true. And what one would then need to do is to make sure they're warm so that the cold air doesn't find you wanting and cause problems, which is dry and cold. And the next thing is, if you know that you get tired when you exercise, 20-30 minutes before the exercise, you may want to take some reliever pumps, or 2 puffs of your salbutamol or whatever form of beta agonist that you're using as a reliever. And then 20-30 minutes later, you go and do your exercise. That usually will put you in good standing. Good.
Interesting indeed. Now, to address some of the questions that you asked on social media, I'll take the first one. I am at a higher risk of being infected with COVID-19 if I have asthma, and that is, am I at a higher risk? And that is from Tebogo Nyati all the way in Bloemfontein.
There's two things to the question, is that obviously asthma causes the inflammation of the airway, which then by implication is probably a risk factor to getting other infections. Also the pumps that we use, especially the inhaled corticosteroids, some of them could predispose you to some infections, which means by implication even these new viruses that we have, we must be worried that maybe they may be, but obviously get your asthma controlled and protect yourself the way that everyone else is doing, and your risk will probably be the same.
All right. Let's see what the second question says. This one is from Anisha Patel from Sundowner. Says, I have asthma and have tested positive for COVID-19. What should I do? Very important question indeed at this time.
They should go COVID, get it treated well, because if it doesn't, it may cause you problems of breathing as much as the asthma would, and it can precipitate the asthma. So have both of them treated nicely so that you may have no issues.
Mm-hmm.
The following question is, I am coughing more than usual and I'm scared that I might have contracted COVID-19. What can I do? And that is from Anonymous in Pretoria.
I think when you're worried, consult a healthcare provider of whatever level, whether you go to the clinic or you go to the hospital, whatever is available in the environment, and present your symptoms and your signs, and They will ask you a few questions, including exposure, including whether you think you have been protecting yourself well or you haven't been putting a mask on well, because some of us put the mask under the nose, so you may have other issues like those. And it's a pandemic, it's what we have, and if you're worried, you have that. But there are other things that go with asthma that can make you cough more frequently, which may include if you have a reflux or if you have sinusitis or you have that. So there are other issues to look at that come as a package. But if you're worried, have it checked, and then we'll take it from there.
All right, let's look at the next one. The next one comes from Marianne Fenter from Potchefstroom. Says, my child has asthma. I'm worried that if he wears a mask at school, it'll make his breathing worse. Quite an interesting one. I mean,
Yes,
people have problems with masks that exacerbate asthma.
Quite an interesting one. I think everything has a cost benefit. So if you wear a mask, you protect yourself against COVID. Could it make your asthma worse? No, but it could make you anxious because you're not used to it and because you're breathing back the air that sounds warm, and most people get uncomfortable with it. But it should not be that it precipitates your asthma by doing that. But yes, if you're feeling tight, in a tight space, and you're feeling uncomfortable, the anxiety, it's sure to contribute to problems.
Right.
The next viewer has also a complaint or question around his child's health, and the question goes, my child has more asthma attacks lately, what should I do? And actually that's from Felicia Naika in Eldorado Park, so yeah, please can you help us answer that?
It has been a cold time of the year, so it may be exposure to cold. It may be that they don't take their medicines regularly during this time when it's cold. It may be that they are not dressing up warmly during this time when it's cold, and that on its own gets you to be cold and make more snots and more secretions and have a problem. And if by any chance it means then the person is getting worse, he may have to be checked. So that's where the action plan comes in. If he needs more of that, then maybe present to healthcare providers to see if they can assist to evaluate him and get him better.
Let's see if we can squeeze in one more question. This one is from Tabo from Foslores. Says, my symptoms have gone since I took the treatment. Can I stop using the inhaler?
I always say it should be teamwork to decide what you do. So he should not think or decide at home alone. He should consult his healthcare provider so that they can go through the plan. And maybe if he is really well living on the test that will be done and they think he can stay on a reliever when he needs it, he takes it, they will make that decision. Right. And eventually when there's less need for the reliever, then it will be that he doesn't. But don't make a decision alone, Mr. Lamin. It may be a problem.
Yeah. Okay, Tabo, I hope the message is loud and clear there. All right, time for a quick break. When we come back, we recap the most important messages about asthma we're going to leave you with. Please stay with us.
These are the important things that we heard on today's show. This is what you need to do if you have got asthma. Please avoid your triggers, if that is smoking, dust, pollen, pits. You heard it all. Make sure that you take your medication as prescribed, please, and ensure that you have got an action plan. Know how to use your inhaler. Make sure that you learn relaxation techniques and learn how to reduce stress and anxiety. Of course, during the COVID-19 pandemic, you need to protect yourself by wearing a mask, washing your hands, keeping social distancing, avoiding touching your face, and surrounding yourself with clean surfaces.
All right, and during this pandemic is not only about protecting yourself, but you still need to continue managing your asthma. You need to take your medication as prescribed. And again, we're going to remind you that you need to use your reliever inhaler as and when you need it. And that action plan that we spoke about earlier, it's not just good to have it, but please make sure that you follow it. And learn relaxation techniques, especially in times of stress and anxiety. And of course, make sure that you stock up on all your supplies and keep your appointments, very important, keep your appointments with your doctor or call your doctor if you can't. And to also just remind you that some of the symptoms between COVID, asthma and allergy can be common. So for instance, if you have asthma and you start feeling chest pain and discomfort, fever, especially if you have other symptoms like loss of smell, loss of taste, those may indicate that, there might be something else happening there in terms of, possibility of COVID. So you need to then obviously go and see your doctor.
Phew, time flies when you're having fun, hey? Unfortunately, that brings us to the end of today's show. I'd like to thank our special guest, Dr. Mukansi. Thank you very much for having us on the show. Any parting remarks?
Thank you for the invite, and also want to remind the asthmatic people that perhaps teamwork is important, and especially the use of the asthma pump. It's something that they should keep on reminding each other with their therapist so that we can get it right.
Okay, very important words there from our special guest. And you guys at home, thank you so much for watching, and thank you for your questions. Just keep them rolling, please.
Please don't forget to send us your questions via SMS, WhatsApp, Twitter, Instagram, and Facebook, and of course on the number displayed on the screen. From my side, Salang Khantle.
And from me, until next week, please look after yourself.